Today we are learning about breast density. Joining me is Dr. Monica Agarwal, a breast imaging radiologist at Wake Radiology UNC Rex. Thank you so much for being here, Dr. Agarwal. We appreciate this conversation. It can be a little scary to have, but something that we must have regardless. So again, we appreciate you being here today.
Thanks for having me.
So tell us, let's start with this. What even is breast density? It's not a term we hear very often.
Yeah. So every woman has some fat and what we call fibroglandular tissue in her breast. Some women have more fat and some women have more fibroglandular tissue. All of it is normal. Women who have more fibroglandular tissue have more dense breasts. And radiologists look at your breast density on a mammogram. There are some things that can affect your breast density, but most of the time it's just genetic. Some things that can affect it are pregnancy and lactation, hormone replacements, and weight loss. Those can increase your breast density, whereas things like weight gain and aging and menopause can decrease your breast density.
Okay, well, does having dense breast tissue actually increase your risk of breast cancer?
Yes, dense breast tissue has been shown to increase your risk of breast cancer up to 2 times the amount of women with more average breast density. Additionally, having dense breast tissue makes it more difficult to read your mammogram because benign and cancerous breast lesions can show up as white, which is what more dense breast tissue or that fibroglandular tissue also shows up as white. That's the reason that North Carolina has a statute that requires us to inform you of your breast density when you get your mammogram so that you can know that you may be at a potentially increased risk for breast cancer if you have more dense breasts.
Well, what is the best cancer screening tool for women with dense breasts? Is this something we can see ourselves, or is this a test that we actually need to get done?
A 3D mammogram or digital breast tomosynthesis is the best test to detect breast cancer. So we used to do what are called 2D mammograms, where we just took superimposed pictures of all the breast tissue on itself. But now that we have 3D, we can look at all the slices of the breast. So if you think of it as a loaf of bread, a 2D mammogram used to be like looking at a loaf of bread from the end. But now we can look at all those slices of the loaf of bread. And so a 3D mammogram helps us in two ways. It decreases the amount that you get called back from your screening mammogram because now we know when tissue is superimposed on itself, and it increases our breast cancer detection because now we can see those small breast cancers in those slices that we may not have been able to see when we were looking at the whole thing on end. And obviously, the whole goal of getting mammograms is to find breast cancer early when they're small and easily treatable. So the 3D mammogram really helps us out.
Wow, that visual really helps me gauge exactly what is going on and how you guys are able to see this and treat it. So thank you for that. And something that we're seeing a lot about or of lately is AI and artificial intelligence tools and how they're helping so many different things. Are there any artificial intelligence tools helping patients with dense breasts?
Yes, so we use intelligence or AI for all of our mammograms, whether you have fatty breasts or whether you have dense breast tissue. It's kind of like a second check for the radiologist. So it points out things that might be suspicious to the radiologist that we should take another look at. So, in addition to reviewing your entire exam, we take an extra look at those areas that AI points us to. And Wake Radiology was the first outpatient practice in the triangle to start using AI to help with reading mammograms.
That's amazing and makes us feel a little more confident when we're going to Wake Radiology for such tests. So, is it easy to get a 3D mammogram at Wake Radiology? How do we go about that process?
Yeah, we've got 12 outpatient imaging centers in the Triangle. All are certified by the American College of Radiology's Breast Imaging Center of Excellence. And it takes about 30 minutes to get your screening mammogram. We try to get you in and out, and I think you'll find that we provide excellent patient care.
Perfect. Dr. Agarwal, we appreciate you being here and helping us feel a little bit better and a little more confident when we go to the doctor about this. Thank you for being here.
Thanks for having me.